Hello everyone, I'm Dr. Heena from Hopewell Healthcare Center, Bangalore. Today, the 29th October is observed as World Stroke Day. And on the occasion of World Stroke Day, I would like to emphasize on the time of hospitalization for a stroke patient. The brain, like all parts of the body, needs oxygen that it gets from the blood. A stroke occurs when the blood flow to the part of a brain is blocked. After just a few minutes, the brain cells which are starved of oxygen begins to die. So hospitalization at the earliest is the need of the hour. Normally the brain receives blood via two pairs of major arteries, that is the right and left internal carotid artery and the right and the left vertebral arteries. These two pairs of arteries will branch throughout the brain tissue and supplies the brain cells with a constant flow of oxygen, glucose, nutrients necessary for their function. Stroke can be of two types, that is hemorrhagic, which is due to the rupture of blood vessels, and it can be mainly due to high blood pressure or hypertension. And the second one is ischemic. In ischemic stroke, an artery in the brain narrows or becomes completely blocked, preventing normal flow of the blood. The blockage may be caused by the blood clot, also called as a thrombus, which forms in weak and unhealthy arteries of the brain. The lack of blood flow causes the tissue starved of oxygen, that is also known as cerebral ischemia. Similarly, the blockage may be due to embolus. Embolus is a blood clot that forms elsewhere in the body and it travels through the brain. An embolus lodges in the narrow artery and obstructs blood flow. Brain stroke is nothing but a brain attack which is similar to heart attack. Symptoms of a stroke can vary depending on the type of stroke and the part of the brain that's affected. Some common symptoms include sudden weakness or numbness of arm, leg, face, especially on one side of the body. There can be difficulty in speaking or understanding speech. There can be blurred vision and also loss of vision in one or both the eyes and other visual disturbances. Then there can be loss of balance or lack of coordination and dizziness. There can also be nausea and vomiting. There can be loss of memory, especially short-term memory loss. Other impairments that can result from a stroke include muscle spasms, difficulty in swallowing, mental health problems like anxiety and depression, and also there will be lack of awareness of the affected side of the body. It is more common among the elderly age group, that is between 50 or 60 years of age. It can also be seen in younger generation below the age of 40 years. And stroke is mainly due to major risk factors like systemic hypertension, diabetes mellitus, high cholesterol, that is hypercholesterolemia and hyperlipidemia, smoking and alcoholism. Then it can be due to sedentary lifestyle and also long-standing stress. And in some cases, the cause may not be known. And stroke can be prevented, or it can be preventable by adopting healthy lifestyle and taking care of the risk factors that we just mentioned. Stroke is a medical emergency. Therefore, timely response to call the emergency line is crucial. Once a patient has a stroke, immediately the patient has to be shifted to emergency ward and the required treatment should be started within 2 to 3 hours. This is because first few minutes to hours in case of a stroke are called as the golden hours. It is because in every minute, millions of neurons or the brain cells are lost. These neurons can be saved if the treatment is started as early as possible. And the earlier the blood is restored to the brain, the earlier is the recovery of the patient from stroke. So let's all together help our loved and dear ones survive stroke, and let's make this world healthier and happier. Thank you.